yourself. Yeah, more people are joining. Okay, perfect. So I just want to officially welcome everyone here for our Courageous Conversations. And today our Courageous Conversation is about climate change and impact on mental health. I'm going to let our panelists introduce themselves. I'm really pleased that we're actually having this opportunity to have this session. As you know, I hope you all know that this month is Mental Health Awareness Month. So it couldn't be more timely for us to actually have this discussion. So I'm really pleased to have everyone here that are going to share their wisdom and share their work around this topic of how environment and climate change are also impacts mental health. So I'm going to turn it over to Marianne Renz, who actually can introduce the panelists, introduce herself, and we can get started.
Well, thanks, Cheryl. My name's Marianne Renz, and I'm active with a group called Citizens Climate Lobby that I'll be making a pitch for at the end of this presentation. I became concerned about climate change and mental health, perhaps because the faculty that I work with as part of the Western Michigan University Climate Change Working Group were reporting that their students were telling them after class how hard they were finding it to deal, emotionally difficult to deal with what they were learning about climate change. And I was happy to be able to get together the two people who are joining me today, and I'll ask them to introduce themselves. We'll start with Laura Carter Robinson.
Hi, everybody. I'm Laura, and I'm really glad to be here today to talk with you all. I'm a clinical psychologist based in Ann Arbor, and I have a private practice called Humanity and Planet, which is exactly how it sounds. It's based on helping people with climate distress and climate-related issues, as well as offering teaching opportunities for professionals in mental health and other professionals in the public as well. And I'm also a psychologist advocate for climate change and mental health with the American Psychological Association, and I'm on the executive committee of Climate Psychology Alliance of North America. And in my practice, I've seen people for many years come through with concerns about climate, people who are really aware, very environmentally conscious. And it's just been in the last sort of few years, this has coalesced for a lot of people and in our profession as well. And so it's been really meaningful to take that and then to grow it and to create part of my practice around that, and also to work with other professionals and trying to get the word out about how important this issue is, because it's really critically important, and most people really do not know about it. And my interest in climate psychology also really stems from my own desire to do something about the climate crisis. And I think everybody really has their own unique part to play. I think we all have a role, and we have to sort of find what that is, and, you know, with our own unique talents and skills and our own values. And for me, this is my contribution to helping with that. So I will pass it off to Andy.
And I'm Andrea Bostrom, and I'm probably the newest to this whole piece, and I'm probably learning on a really fast learning curve, but I'm a psychiatric nurse. I've been faculty at Grand Valley State University up until a couple years ago when I retired, and really do try to be an advocate for mental health care overall, and I'm learning how to fit the issues about climate and climate change into that practice. Thanks to Marianne and the swimming pool.
That's something that probably nobody else would understand, but I actually met Andy in the hot tub at the YMCA. YMCA. So back to you, Cheryl.
Thank you all. Again, welcome. So actually what I'm going to do is start off with just asking some questions for the panelists. I know that, you know, the topic is about how climate change and climate relates and mental health, but can you tell us exactly how does climate related events impact patients and persons' mental health?
Yeah, I'll jump in and answer that one, Cheryl. First of all, I think from an overall perspective, climate change is an existential threat to all of humanity. And so right there, just off the top, we're talking about something so significant, so serious, and so hard to wrap our heads around. And so I think that's just sort of the context that we need to place it all in. Aside from that, sort of when you drill down a little bit into specifics, there are about 7 pathways that have been identified as ways that climate change impacts mental health. So I'll kind of just run through those a little bit and give you a little example on a few of them. So number one is displacement and migration from places that are no longer inhabitable. And again, these are things that happen worldwide as well as in the US. By 2050, it's expected that 200 million people worldwide will have been displaced by climate change. That's 1 in every 45 people, which is really astonishing. So the scale of this is just so tremendous. Number 2, food insecurity and malnutrition from places, for example, where there's drought and it's impossible to grow crops in the same way. Number 3 is aggression and violent conflict. That can include things like interpartner violence, child abuse, and also civil war. We also have economic and social losses, number 4. Number 5, we have anxiety and distress around climate change. And that's something that most people kind of know about that one, or it's starting to be kind of a buzzword. And we'll talk more about that because that's a really significant piece. But it's only one of the pathways. So if you think about all of these ways that it's impacting. And then the last one, exposure to high temperatures. And this is a really big one. I'll kind of spend a moment on that. As temperatures increase, there are a lot of other things that increase related to mental health. Those include psychiatric hospitalizations, substance abuse, sleep disorders, cognitive disturbances like having difficulty focusing on tasks, memory, attention, things like that, and violence and suicide. And suicide being a really, really big one that I think most people don't know about. And so there's data I think we'll talk about throughout today around that. But some of the recent data around suicide, there was a really nicely done longitudinal study in the US and Mexico. And based on their findings, what they predicted was that by 2050 in the US and Mexico alone, there will be thousands to tens of thousands of additional completed suicides just due to increased heat. So it's really, really significant. So I'll kind of leave it there. Well, one more thing actually to add about heat is that some psychiatric medications are rendered a little bit less effective with increased temperatures. And also, and it's kind of really double bind here, and also some psychiatric medications make it more difficult to tolerate heat. So there's all kinds of ways when we think about even severe mental illness there and types of medications people are on. So lots and lots of things here for sure.
Wow. Thank you for sharing all that. Lots of information that I wasn't aware of, pretty sure others not as well. But keeping in that same vein, how widespread is this? How widespread are mental health concerns that are connected to climate?
Well, there's a lot of evidence on that as well. The online environmental news source, GRIST, reported in October 2021 on the Google New Labs data editor's statements that searches for climate anxiety were up 565% over the previous 12 months. Probably one of the best sources for information on how widespread the concerns are is the Yale Climate Opinion Surveys. They've been doing those surveys for 20 years about what the American attitudes are about climate change. And only in the last 3 years, predominantly, have they been focusing also on mental health concerns. As Laura said, this is an area of increased importance recently. About a half year ago, a study from the Yale Climate Opinion Poll reported that there is a small but noteworthy group of Americans who reported mental health concerns related to climate change. So, for example, 34% described themselves as afraid, 32% anxious, 29% hopeless, 23% depressed. And when asked the question over the past 2 weeks, For several or more days, have you felt symptoms of anxiety? About 1 in 10 people said yes, and about the same number of people for symptoms of depression. And 14% expressed hopelessness, that it's too late to do anything.
Yeah, and I'm happy to add on to that as well. You know, I think we all can chime in on this piece. That's such important data that you're sharing there, Marianne. And you know, I think another data point that I always think about from the Yale information as well is the idea that 64% of Americans are worried about climate change, and about the same percent don't ever talk about it. And that's something that's really important when we think about mental health, because we think about how, you know, no one's out there. People feel really alone, not realizing other people are worried. And so that matters as well. And I wanted to throw in too another study to build on what you were just saying, Marianne, of you know, there's this really huge landmark study that was done. It just came out in 2021 by Caroline Hickman, who is at the University of Bath, a huge number of scholars in this area. And it was 10,000 young people, ages 16 to 25. And they were all around the world, 10 countries, 1,000 people from each country. And these countries represented the global north and the global south. And it was equally divided among male and female participants. And they found, I'll look at my notes here to get the exact percentages because they're so astonishing and so disturbing. They found that in their beliefs about climate change, 56% of respondents, again, these are age 16 to 25, believed humanity is doomed. 65% feel like the government is failing young people across the world. 75% found that the future is frightening. 83% feel that people have failed to take care of the planet. They also 57% felt that climate change makes them feel powerless, 58% angry, 63% anxious, 68% afraid, and 68% sad. And only 5% of those 10,000 young people are not worried at all about climate change. So when we think about this, you know, with all of us who are of a certain age, you know, we remember a world that didn't have, you know, we weren't aware of climate change. You know, there were things happening. We really, you know, didn't grow up with it in the same way. But people growing up now, children and young adults, this is the generation that has grown up with this being part of their lives every step of the way, and it always will be. And that has really significant mental health implications. It's a really big thing.
Thank you for sharing that. And speaking about the mental health implications, what are those most common mental health issues that are seen? What are the kinds?
Well, I'm going to share my screen. I'm going to be fairly concrete about this as well. So I think in general, we've already talked about anxiety and depression relative to the kinds of mental health issues. I think in practice, you're likely to see other things. Post-traumatic stress disorder, obviously hopelessness and suicide. And I think grief and loss, as people start recognizing that things that they've held dear are no longer available to them. We don't think about it as much with Michigan because we don't seem to have such extreme events, but we still do have extreme events with floods and heat and an occasional tornado. We have issues that do cause people to have significant loss as well. So.
Thank you.
Yeah,
So,
if I'm, do you have a moment for me to jump in there too?
oh yeah, absolutely.
Add a little bit more, you know, to that, yeah, with Michigan, it's interesting because, you know, we're just sort of getting a taste, but there's plenty more that's coming. And, you know, Michigan is warming quite a bit, and I don't have it right in front of me or you know, but there's, I guess the predictions are, you know, depending on kind of where you are in the state and depending on how we manage emissions, the different parts of the state will be, like Kentucky by, I think, 2050 or maybe 2100, like Oklahoma, things like this. Like Michigan is going to change dramatically, and the severe weather is going to continue to increase given the warming and the effect that it has on the ice cover on the Great Lakes, which then destabilizes the whole system around us. So it's huge. And Andy, brought up so many great things. I also want to bring out their burnout for activists. And again, that grief and loss is so big, and learned helplessness that people feel and hopelessness is so big. And learned helplessness is that idea that you try and try and try, but you can't change something. And it's linked with depression. Even aside from climate things, it's always been linked with depression. And in climate, you can see how it just fits right in. And I do, as we're kind of starting this conversation, I think it's really important too to place issues of mental health sort of against the backdrop of kind of what we all experience. And so those of us who are in positions of privilege relative to the effects of climate change, and I count myself in that group, we often live in or like cycle in and out of some kind of state of like mild denial, right? Or mild dissociation from the effects of climate change. We kind of can't live with it. It's so hard. It's so hard to face. And so we kind of have in the back of our minds, maybe, or maybe sometimes we experience an event, but we kind of keep going, and we kind of keep doing what we do, not realizing like every single day actually really, really counts. And that's because, again, it's so immense and so terrifying. And so, and we also don't kind of know what to do. So when we think about that, and then when we do face it, it's really destabilizing. I think probably all of us here on the screen at least have had moments where, it just hits you and it's just unbelievable. And so I think as we are thinking about this, really thinking about ourselves and all of you as professionals, that you're in this with your patients, right? We're all embedded in this together. And so it's a sense of empathy, right? A sense of shared humanity. And so when we're thinking about mental health, kind of what that means together as a community, as opposed to a label. And so I think that's just part of grounding our discussion for today.
Thank you for that information, Laura. So, we are very concerned, and actually part of our pillar now, our foundation, is a health equity. And really, how does equity relate when we talk about climate change? How does that apply? How does equity apply to that, to the impact on mental health and availability of treatment?
Well, I think we're going to divide our answer to this into various subcomponents, but I'd like to talk about the impacts of climate change itself in relation to equity. And the statement has been commonly made, both worldwide and in the United States, that the least responsible for climate change are the most impacted. That is, the people who are most responsible for climate change are those who have big mansions, their own airplane, their own yacht, and they're producing a lot of greenhouse gas emissions, which are the primary culprit in climate change. And those who are poorest have a smaller carbon footprint by far. But I'd like to give a couple of just generic examples of how this might play out too. Let's take a case of two families in Kalamazoo facing the rising temperatures in the summertime. And one of them lives in a poorly insulated home without any air conditioning, has fewer trees to provide tree canopy, the shade that the trees would provide, and the reduction in the temperature in the air from the expiration through the leaves. The other family lives in a well-shaded home that's well insulated and has air conditioner. And you can guess which one is poor and which one is not. So in that particular case, equity is an issue from rising heat. Or take a case of a flooded home, which could happen in a wealthy community too, but the wealthy community is more likely to have a built structure to prevent the rising waters from entering the home. And is more likely to have flood insurance, and should the home be flooded, is better able to repair the home than the family with fewer resources. And on a different topic, one of the things that happens with climate change are increasing increased vector-borne diseases. So the fear of being outdoors and being bitten by a tick, if you were bitten by the tick that carries Lyme disease, your best solution is to have quick access to medicine, to a shot that's going to mitigate the impact of the tick bite. And the poor family is less likely to have that access to medical care for quick treatment. And the poor families, such as those who are working as migrant farm workers, we had a program about that last month. They're going to have greater exposure to elements like tick bites and mosquito, so that cause problems as well. So from the very beginning, those least responsible for climate change are most impacted by it. And those are health issues, or other factors, but they are definitely going to impact then the mental health of those people impacted by climate change.
So building on that, all the things that we consider for social determinants for healthcare are filter into the issue of people being more vulnerable relative to climate change. So as Marianne was talking about, the less money we have, the more likely we are to live in places where there's more concrete and the temperatures are higher. We're going to be living in places that are closer to industry. People, families that have single parents and children who don't have funds to help pay for health care or to access health care. We have huge issues here in Michigan relative to access in general, just access for mental health care, who can get it, relative to Medicaid, the issues about the word is failing me here all of a sudden. The gatekeeping issues relative to mental health care in the state are really significant, and the social determinants make things much harder for people to get into access mental health care, let alone mental health care where people can consider the climate issues relative to their health. So.
Yeah, absolutely. And, I'll add on to, like we said, we'd kind of divide this answer up. I mean, there's so much to cover around this. And yeah, just building on what both of you said, climate change is this multiplier, right? So it amplifies all of the social and political and economic problems that are there. So poverty, political instability, things like that, as well as the systemic stressors that happen, right? So things like inequality, lack of resources, all of that kind of stuff, again, both in our country and worldwide, those are amplified by climate change. So people who are already disadvantaged in our society, who are already marginalized, already struggling, already dealing with, really systemic issues of having access and equality in general, right? That these groups are the most at risk by far. So. And that includes like a whole range of people, right? So when we even think about, so Black Americans, for example, rank the highest in terms of their being worried about climate change. And, it's maybe not surprising, right? Like people are facing, again, these systemic issues, and then this adds on to that and makes it worse. So, and when we look at that too, things like, there are sort of the historically redlined cities around the country, including Detroit, are among the hottest places in the country. And so, those temperatures are going to get really high there, right? So again, that amplification of something that for decades has been a systemic issue of oppression. So, it's really significant. And thinking about other groups too, there are people who are, like I said, Black Americans, people of color, Indigenous people, the elderly. I mean, the list is really long. People who are LGBTQ. We talked about poverty, women, children. We'll talk more about children in a minute. And I also want to point out people with disabilities and chronic medical conditions. You think about, medically, people like, for example, with something like POTS, right, where tolerating heat is incredibly difficult. So people with chronic things like that, severe mental illness, like we've talked about, the list is really long. And just thinking about resources for treatment, as Andy kind of alluded to, we already don't have enough treatment. And for climate, we don't have enough treatment for people everywhere, not to mention the people who are going to need it most. So this is so new, and the research is new, and the treatment is very new. And so kind of what we have is a situation where there was really just a very recent study done. It was the very first study that asked mental health professionals about their sense of competency in dealing with climate change with patients. And 67% said they could not do it, even though they felt it was really, really important. There's really not very much training out there about this. It's just starting to appear in places. And so you have a whole bunch of people who are going to be needing help and who already need help, who aren't going to get it. And just to look at some Yale data quickly, Yale asked for the first time this year about what kind of mental health treatment, if people were seeking mental health treatment, and in fact found that 2% of Americans are already talking with therapists about climate change. So that's like 7 million people almost. And then 2% were definitely interested, and I think it was like another 5% that were somewhat interested. So that's now. Think about what that is going to look like as things increase, and we do not currently have the mental health professionals to keep up with this for sure. And yeah, just building on Andy's thing, it's just a huge issue of people already not having access to care and all the barriers that are going to go even more to preventing that. So this is a huge environmental justice and social justice issue, not just to provide treatment and make that treatment available, but also to mitigate climate change. It would be better if we could prevent some of this from happening by taking action now.
So I just wanted to add in too, Marianne talked about the migrant workers, and we talked a little bit about cities, but one of the things, especially in a state like Michigan, where we have so much of our land use is rural and farmers, and I don't think our farmers have adequate access either to health care in a lot of ways. And they're really particularly vulnerable to losing. I mean, we have issues relative to our fruit trees and the freezes that come and go, so that they lose their crops. So that whole issue about loss. We already have lots of, this isn't mental health, although it could be, we have high rates of skin cancer with farmers. There are a lot of issues relative to farmers and they just don't really, quite honestly, have the kind of access to healthcare that they need, let alone the healthcare related to climate change, which are going to have more and more impacts on their livelihood and their life.
Yeah, absolutely. They're on the front lines of climate change. And so for any of you who might be working with them now or in the future, farmers have suicide rates that are comparable to those of military veterans. And that's now. And they're looking at their livelihoods changing and trying to manage things that are not manageable, really, as things shift. So it's a really, really important point that you're bringing up, Andy.
Thank you for sharing all of this. And so, regarding then this problem and how huge this problem is, what can health practitioners do? How can they treat clients, that are suffering mentally, having some of the mental health problems that you've mentioned, that is harmful, that's caused or harm, they're being harmed by climate change. What can they do? What can practitioners do?
So
what would you recommend?
Yeah, I'm going to start a little bit here with, and I know that Laura will add on to this, but I'm going to share my screen as well. One of the main concerns that I have is relative to, let's see if I can make this advance here. There we go. Is that we don't pathologize issues related to mental health and climate. I mean, certainly if people are depressed, they need to be diagnosed as depressed, or if they have anxiety, they need to be diagnosed with anxiety. And we do have treatments for that, medication treatments for that. But a lot of the things that people may present with related to their mental health and climate need to be considered alone and isolated for that. So some of the typical mental health screenings, I think all of you probably know, the PHQ-9 and the GAD-7 have questions on them, and typically in practice we'll give them those screening things, and we'll add up the scores and decide whether they've got a problem. But I think it's more important to take a look at the questions that are involved in that, and follow up on that. So if we're looking at anxiety with a GAD-7, if people say they're feeling nervous and anxious and on edge, it might be worth it to ask them if that's related to a climate issue. If they're worried about that, they're unable to stop worrying, if they're worrying too much about different things, if they feel afraid. So if what that fear is and that worry is related to climate, that doesn't necessarily mean that you're better off giving them an antidepressant. It may be that you need to look at other ways to help them deal with their worry. PHQ-9 also looks at things like little interest or pleasure, hopelessness, feeling bad or failure, or feeling like you're better off dead. Again, looking at the suicide issue, do you have a diagnosis of depression that you need to work with, or do you have this issue that people are sitting, again, continuing to worry and think that life is hopeless relative to the environment around them? So I guess my main issue with these is remembering that these are screening tools, they're not diagnostic. And once you've screened, it's worthwhile to pick at those items and make a decision about whether you need to treat an actual diagnosis, or if you need to help people treat an environmental or a situational event. And then the other one that I'm going to just toss in here is adverse childhood experience screening, the ACEs screening. Again, this doesn't necessarily suggest a direct issue between climate and mental health, but it may suggest the powder keg that can be ignited by excess environmental heat or environmental situations. So I would just suggest that again, in looking at screening, the 10 items include things about neglect and the loss of a parent for divorce or incarceration, parent caregiver with mental illness or substance abuse, or just basically unpleasant, unsupportive adult caregivers for children. But if those things are present, they may again be things that suggest vulnerability to when things are in the environment are too difficult. And I'm going to toss that over to Laura then.
Great. Yeah. Thanks, Andy. Yeah. So much important stuff there that you're covering. And I want to kind of just maybe go back over a little bit about some of the treatments and things we were talking about there, and issues around that. And then maybe come back to the children piece of it too, because I think that's really important in terms of who's kind of at most risk, and kind of combining some of the questions we've been talking about. In terms of pathologizing, many people are reporting feeling really invalidated by their mental health practitioner. And Andy, I know your slide is still up. I don't know if we want to take that down or no, but just FYI. So a lot of people are feeling invalidated. We're still kind of looking at this model, kind of working inside this model, where we think of sort of the pathology being sort of inside the person, right? Whether that's for a biological reason or for whatever reason. But really, when we look at climate change, just as when we look at certain other social factors, right? It's sort of important to look at this more as like a systemic issue. And so to really consider this person in the context of their environment, because this environment is really dysfunctional, right? We have really dysfunctional stuff going on around climate change. And so when we think about it that way, it helps to sort of think about not pathologizing, right? That in fact, it's kind of, we consider it kind of a marker of mental health, actually, to not be in denial about climate change. This is real. It's reality. People are reality based when they're coming in and saying, this scares me. So that's important, really important to validate that. And so being aware, like you're doing by being here today and really thinking about that, can help you feel able to validate and that it's real. So at the same time, there are issues of diagnosis, like you both kind of brought up. climate change can present sort of by itself in treatment, an otherwise healthy person who is just really struggling around this particular issue, but it also can exacerbate other mental health disorders, and it can present also as just like maybe a component of something else. So you might have somebody who's really struggling with climate change, but they also have, generalized anxiety disorder, and this is just one piece, right, or one piece of their depression. And so it's complicated. It's not sort of a one size fits all kind of approach. But the key that, that Marianne was saying was, or Andy was saying was, just to not go in with the pathologizing piece. And another thing just around, sort of where we are with treatments, we don't have any empirically supported treatments right now. All of this is just too new, and those things are being worked on. And it's also complicated because this issue is so deep and so painful. And so there are there limits to some of our ways of approaching treatment? Maybe, right? So there are ways to, kind of how do we handle and just be with people, that uncertainty, the incredible people are having to tolerate. Really important. I do want to say, our ethics codes, certainly in psychology and others as well, really point to the fact that in situations of emergency, right, in situations where things are coming up for people and for populations, and there is not yet treatment that we know about, that we still go ahead, we still try. That is literally part of our ethics. And so, we do know things. We are starting to learn what are some things that help, and we can talk about that too. But even though we, so not having sort of things in place, reason to not start addressing this, because the need is there. And I wonder too, Cheryl, I don't know if we want to go back to sort of who's most at risk. I know Andy talked about children a little bit, and there's a lot we could say about children and their risk that might be important to throw in there. What do you think?
Yeah, that would be great, because that was one of the questions I was going to go to. So yes, who's most at risk?
Yeah, great. And then I know Andy can throw in more if there's additional stuff there, or Marianne as well. With children, hands down, children are, they're in the risk of people who are at risk in general, and they are definitely the most at risk from all of the effects of climate change. And from a mental health perspective, that's really significant. So, right now, 1 billion children are living in the 35 countries around the world that are at most risk from climate change. So it's a huge number. And by 2050, heat waves will affect almost all children around the world. And if we think about some of the things we talked about what happens with heat, you can make the implication there, right? And the ripple effect from that. So from a mental health perspective, when we think about kids, kids developmentally, events have a much larger impact on them than they do on adults because of just how their developmental process works. And so during their formative years, they're also building a sense of security in the world, which talk about like baseline anxiety versus security as you're going into the rest of your life, right? That's building in those early years, as well as a sense of security around other people. Can other people keep me safe? Is the world safe, right? So we're talking about really destabilizing stuff at a very young age, which is really, really formative psychologically. And children exposed to disasters are a lot less able to cope than adults. And we don't need to even explain that, right? But it's so obvious. They're dependent on others for care, and often during, disasters or even migration. I mean, all of the things that we think about, even short-term events that happen related to climate change, that parents are stressed out. They're trying to cope with a lot, and kids are really not able to do anything. They can't deal with this issue. They have no control over this issue. And so they're really reliant on caregivers who might not be sort of coming from their best place as this is happening. And we do know that's also one of the ways in which child abuse enters in. So families that are most vulnerable to not having housing and food after a disaster are families where child abuse that are more characterized by child abuse in those situations. So, and then that affects childhood mental health, of course. And then just a quick thing, chronic stress in childhood, which can occur with just, again, this lifelong, these kids are being born into a lifelong problem with climate change. And chronic stress affects, brain development. It affects gene expression. It affects brain functioning, lifelong problems with behaviors, attention, emotion regulation. It's just all over the place. And I will say even kids who are not experiencing climate change directly in ways that they might recognize, because a lot of times people are not aware that the things around them are climate change, but they are. And but they're still learning about them in school. And that's a big thing because that's also very new. And so it's not always being presented, or the emotional component is not being handled. And so kids are often getting exposure and then they're really scared and they feel powerless and they don't know how to help. And so there's all these ways in which children are really, really at risk and so vulnerable. So kind of leave it there with that.
Thank you for sharing. So given these risks and the concerns we have, particularly for those most impacted and not really having any, real prescribed treatment, do you have concerns about applying what we have for traditional treatment of mental health for patients in this context?
Well, I mean, I think as Laura said, I think being more aware that climate may be a cause of some of the issues, and addressing, certainly the stress can lead to changes in the brain and cause and emotions, but dealing with the stress directly related to and concerns directly related to climate, being willing to discuss them, being open to being understanding that may be the source of some of the concerns that the person has. And I know in our current healthcare system, a lot of folks are moving people through really fast, and having, taking a moment to have those discussions is really challenging, but it's probably vital, because if the cause of someone's, well, and I didn't mention much about grief. I mean, grief is not depression. If stress and grief and nervousness about what's happening that you have no control over are the source of the symptoms, we're not going to solve the problem by just throwing, say, oh, you must have depression, here, let me give you an antidepressant. That's not going to solve the problem. And so the traditional stuff isn't going to work if we don't look at the source, better at the source.
Thank you for sharing that. So we're nearing to the end, but so much information that you all have shared that's, like, I think very helpful to those of us that are in the, practicing as well. It's just information. I like to open up to persons that are on this call, that are here, either in the chat or raise your hand for any questions that you may have, anything that, resonated with you, or you want to actually ask more questions about in this conversation to our panelists. Please feel free to put in the chat or raise your hand, and you can, great, okay. I can't see whose hand is raised. Oh, okay, Nabil. You're muted. Nabil, you're muted.
Okay, yeah, sorry. So I've recently been in a situation where the two family members saw climate change in a different way. The intensity of it is different, and how that translated to how they were dealing with the situation. So kind of there's not a common ground of understanding, and that kind of caused more of a conflict in communication that way. Any suggestions on how to bring people closer together so they're on the same platform when those kind of conflicts kind of happen? And that can cause a lot of stress. Somebody can feel really helpless, and you don't understand me, the world is ending, and the other person's like, well, whatever. So
The conflict of our decade, I think.
Yeah.
I'm guessing that Laura has the best background to answer that question, since she deals with folks in therapy.
Yeah, I'm happy to jump in there, but it's a really hard it's a hard situation. I've seen that as well, and it's a really tough one to navigate. And I think that it's obviously you have sort of maybe some work around trying to help people understand, are there any common elements there in each other's point of view? But I also think it's important for the person who you know, who is struggling with the climate piece, right, and feeling frustrated that the other person doesn't, that there are places that that person can go to maybe find other support. And if they're not getting it from that person, it sounds like there may be, I don't know if there are other couple issues going on there or not, right, that may contribute to this. But, you know, there are groups that have sprung up that are really important and that are serving a really important role. Those are, you know, and we can, you know, maybe send them out. If you want to put your name in the chat or something, maybe we could send a list out later or something like that. But, you know, there's the Good Grief Network. There are all kinds of online groups, as well as some in person, depending on where you are. There's like climate circle groups. There's all you can save circles. There's all kinds of things, and climate cafes where people can join and talk about their feelings, because people do feel really alone. And it's, I think, really, really amplified when it's someone, it's your partner right there in your house, and it's just really painful. And so being able to even process that with other people. And then, you know, just a plug for Climate Psychology Alliance of North America, which I'm on the executive committee of, we have a climate aware therapy directory, which is the only one of its kind in the US. And that's a place, if you know, if you want to find an actual therapist who could like help that person with those particular issues, that can also help. You know, or learning more about it yourself. There are lots of resources there, and same thing with Climate Psychiatry Alliance. So, you know, so it's, I don't know, I wish I had an easy answer, but I think I would encourage some support for that person around maybe joining up with some groups and things like that. And yeah, and maybe finding what are some of the commonalities they might have. Is there anywhere in that other person's view, any piece that they connect to in nature or the environment? Sometimes people don't realize, oh, I really love gardening. Well, gardening is nature. What does that mean? How does that connect to climate? You know, and things like that, helping people put those pieces together. So I don't know if that really helps, but at least maybe that's a little something.
Yeah.
Well,
it helps.
it's also
Yeah. Thank
it's also the issue lots of families are dealing with when there's strong polar beliefs about things, and learning how to have good discourse about things that we disagree with. And it's hard to be a family member in that situation, but I think that's probably one of the benefits of therapy some ways, that if you can get people to understand how they can present better and be less defensive in those kinds of situations, so that they can have the discussion around the dinner table with people that are diametrically opposed with each other. But I mean, we're all having those issues, I think, not just on climate, but lots of other things, and unfortunately, so.
Yeah, I noticed that in that one particular interaction, it was the person who was more concerned about the environment didn't have the patience they already had their convictions, and there was a lack of patience to bring the other person. So they ended up in a kind of discussion without bringing the other person along. So being a good human, right, is kind of, you know, just having that conversation. But that's something that I think people forget sometimes. You know, we have to
Right.
even start on that level to talk. Just get back to the basics. So
Yeah.
explain.
Absolutely. And I think sometimes people feel the urgency so strongly when people are invested in climate change, because the urgency is there and they feel it, and that lack of impatience or lack of patience with other people who are not quite on board. I think, yeah, it sounds like finding some kind of outlet too for that person, as well as constructive conversation. You know, what kind of action might they be able to be involved in that could, you know, help them feel like, okay, they're doing something. And so it's, maybe they can then find some space to be with the other person.
Thank you.
Yeah.
Anyone else have any questions for the panelists? Shabani. You're muted.
I hoped I would see more clinicians for this conversation, because this is such a vital conversation, and it's not kind of restricted to either Michigan or to this country. But like one of the topics, one of the points that Laura touched upon, or I don't know, maybe Marianne, I'm not sure, but like somebody touched upon the climate change affecting the farmer suicide rate. And that actually is kind of not yet very pronounced, but it is a global health problem given the climate change affecting all nations, especially the developing nations with a lot of droughts and the geopolitical scenario. So I think there are opportunities to kind of like look at what, and those equity issues to healthcare access are pretty much similar in different setting across the world. So I think that there needs to be a more kind of awareness about this being like a global health problem, and more kind of like joint conversations on how to address, even if it means kind of like planting a tree. If that's the beginning, so be it.
Yeah, absolutely. I mean, I think, I think the issues of inequity are really prominent between the global north and the global south, for example, as you're describing. And what that part of this is not just looking at how can we help our own patients, but really how do we take this in a bigger way to think about humanity and all of us as part of humanity, and what can we do to help people wherever they are, and not just us, but everyone, and really thinking of ourselves as a global community that way. And there has been so much fracturing of that idea, and I think it's but I think it's really central to addressing climate change. And and there are all kinds of things people can do. And you talked about planting a tree, and there's lots of things that are really important. You can find lists online about what are the big things, and I'm sure we'll talk a little bit about action too, and things like that you can take to really do something, and to try to stop this. And that's a way of helping people all over the world. It's really important. Yeah, so thank you for your comment.
One of the things that one of the things that we talked about as we were brainstorming what we're going to do here is that, as a clinician, just being willing to kind of post, like, having a poster in your waiting room that says, I'm concerned about climate, or, something that says, I'm willing to talk to you about climate change, which makes it a positive thing that you can do. So people know that if they have concerns about that, that's something that they can address with their clinician. Which again, we're not thoughtful about that, I don't think.
I think it's a very good point, especially because our younger population, especially the older pediatric population, where they are more sensitive to these developments that's happening about their future. I think that's a fabulous idea to provide to our adolescent and the younger pre-adolescent population, so that they can talk about their anxiety, and if there are issues, those can be addressed by their providers. Yeah, that's a fabulous point.
This morning, I was talking to a friend of mine who happens to be a therapist, and I asked her whether many of her clients were concerned about climate change. And she said, yes, most of them don't come in with that as the particular problem in her situation, but she actually recommends to them Citizens Climate Lobby as an antidote to despair. Action is the antidote to despair. Joan Baez is the one who apparently said that first, and I repeat it often. So I'd like to talk about the reason that I think joining Citizens Climate Lobby, and I'll be brief and totally unbiased in this, is a good solution. It recommends powerful solutions, and the sense of hopelessness is reasonable if there's no good solution, but there are some good solutions. Primary one being cutting back on greenhouse gas emissions. And so we advocate for a carbon fee and dividend to price fossil fuel emissions, making that as the source of energy less attractive, and thus encouraging a transition to clean energy. So we support big solutions, and big solutions are important. We work as a group. Those solutions cannot be achieved independently. So different from changing your light bulbs, which you can do by yourself, and that helps, but it's not a big enough solution. So collective action that will implement major solutions and put people in connection with one another so that you're operating collectively, you're surrounded by like-minded people, different from the partners who did not see the world to get similarly, the climate change threat similarly. You're able to be around people who can validate your concerns. You're not isolated. You can process your feelings together. You've got social connections and support. And actually, there's some evidence that that's really critical. Sarah Lowe, who's an assistant professor of public health at Yale, recently, just 2 months ago, published an article that reported on their findings, suggested that collective action can buffer the effects of climate change anxiety and prevent it from leading to feelings of sadness and hopelessness that would be consistent with major depression. So it's the increased sense of personal agency and efficacy, a greater sense of hope that's important. And Citizens Climate Lobby is also free to join, so that's another plus.
Yeah, and oh, I'm sorry, I didn't mean to interrupt. Do you want me to go ahead, Dr. Dixon? Okay, great. Yeah, thank you for that, Marianne. And I just wanted to sort of, as we're closing, kind of build on that idea of action, because I think there's so much that's important around that, and kind of just like throw in maybe some ideas of like, what can people take from this, right? There's the action piece, which is so critical, but what other things might you do, as you're seeing people, this comes up, what do you do aside from referring for therapy, which is always good if you need it, right? And referring to groups, also important, letting people know about resources. But I think, just a few things, like first, again, approach this as a fellow human being, again, embedded in the same crisis, and also do your own work around climate change. Really like sit with it, see where you are with it, and kind of confront it. Ask them about it. Definitely ask them about it, as Andy was talking about. Most people say they never bring it up because nobody ever asks them. It comes up in therapy like that all the time. Validate it, like we talked about. Giving hope by providing resources. Hope is so key. There's a big narrative around doomism right now, which is very dangerous because it shuts down action, and we need action. So really giving people hope, not naive hope, but like realistic hope, very important. A lot of physicians might know about nature prescriptions, which is a big thing in Canada. Just be aware that we have tons of data about how important it is to be in nature and how much it helps our mental and physical health. And so that's a great idea, right? Sort of have people spend time in nature, but also be aware, this is not often talked about, but there are people who are really triggered by that. So if their climate grief is really high, if they've had a traumatic experience like a fire or any other kind of traumatic experience, that can actually be really triggering. So it's not a one size fits all thing. So just be aware of your individual client, or patient. Telling people to watch their media intake is huge. We get vicarious trauma, very demoralizing, and having people block off times, like you don't need to be on social media 24/7, right? And taking in this news, it's overwhelming. Mindfulness has been shown in one study, it's the only study that's looked at it so far, to be inversely associated with climate anxiety. So encouraging mindfulness activities and ways of kind of decompressing and getting into that space is important. The idea of collective action, very key. And the idea that people feel they have to handle this all on their own, and no one can do that. So letting people know, there are other people who care, and there are other people they can work with and talk with in groups, joining groups like CCL, all of that, very, very key. The whole narrative of individual responsibility was actually put on us from the fossil fuel industry. And that's a whole other story. So, we can't do it all alone, for sure. And it's also letting people know when you do something, there's a psychological effect called social contagion. And when you do it, other people do it. And then it builds, right? So your actions matter, and they amplify, and they create a ripple effect. And that's important hope, a message of hope to give people as well. So those are some things that might be helpful just to people to know.
This is excellent presentation. I want to thank all of the members of the panel. And I want to thank all of you all for joining us today. This is recorded. So it will be an opportunity for others to actually see the site, actually learn, because I learned a lot. And I think others that have been here learned more things. But unfortunately, our time has come to an end. I was going to ask for Marianne to put in the chat how to connect with Micah, how persons can join up, if there's actually something you can put. If not, we can send it out to people. How do they join?
Yeah, I cannot provide the MICA contact online, but I can give
Okay.
that to you. Citizens Climate Lobby, just put in citizensclimatelobby.org.
Okay.
Doing that.
Got it.
Yeah, and I can send some information as well. So maybe we can create a few resources to send out to people.
Perfect. Again, thank you all for your time. And this actually could be a much longer conversation, and maybe we will have a part 2, because there's many more questions I'm sure that people have, and there are persons who haven't been here that actually could benefit from this. There are some things in the chat that were mentioned. Dr. Rothstein mentioned about emphasizing the advent of infectious diseases such as dengue, fever, melanosis, and how that poses yet another climate-associated fear, and sense that changes, that things are changing and not in a good way. So thank you for that. And Julia, caring for the Earth's health is part of caring for your health. So thank you again, everyone. The CME code is there for you all that will claim CME. And I want to thank our panelists once again for your time. Thank you, everyone.
Thank you.
Thank you, Dr. Dixon.
Thank you so much.
Thank you. Bye-bye.
Bye-bye.
Bye.
Thanks, Laura.